Welcome to our video about the psychological impact of diabetes. Increasing the awareness of the psychological impact of diabetes in communities is critical. An effective advocacy program must improve the psychological well-being of persons living with the disease. A case study must be developed to describe the individual's experience. It should describe the disease, the treatment, and the lifestyle changes that have contributed to the development of a positive emotional and physical outlook. In this case study, the patient focuses on the psychological aspects of diabetes. In addition, a community-wide advocacy program should be developed. Case study: 1/3 of adults with type 1 diabetes experience high levels of distress related to the condition. It can negatively impact work performance, relationships, and emotional health. Additionally, 20% of people with diabetes have impaired hypoglycemia awareness, which increases the risk of severe hypoglycemia. The fear of hypoglycemia may severely impair normal functioning. This study provides further insight into how diabetes can affect mental health. A case study of the psychological impact of diabetes by Dr. Wendy Maltinsky of the University of Stirling explores the challenges associated with insulin-dependent diabetes and the use of behavior change techniques to facilitate lifestyle changes. While the psychological impact of diabetes on a person is often overlooked, it is important to understand how to address it successfully. While knowledge of the disease is essential, the psychological impact can hinder a person from engaging in daily activities. Although diabetes is typically treated as a childhood illness, adolescents and young adults should be given special attention in research focusing on this group. Young people with type 1 diabetes may be particularly vulnerable to psychological distress because of the emotional burden of managing their condition. In addition, the transition to adulthood may be accompanied by multiple transitions, including changes in social relationships, healthcare, and lifestyle. Longitudinal research will help identify key factors that affect people's ability to manage their diabetes. Young adults with type 1 diabetes are at an increased risk of developing eating disorders. Since they must focus on energy and food intake, they may experience disordered eating behavior. While diagnosable eating disorders are rare, they are harmful to their health and worsen their glycemic control. Young women with type 1 diabetes should be especially careful about their insulin levels and not attempt to control their glucose levels using unhealthy weight loss methods. In general, the cognitive and emotional effects of diabetes are closely linked. In fact, type 1 diabetes is associated with a higher rate of depression and anxiety, as well as lower quality of life. However, research on these issues has been lacking. This study is a good start to understanding how these two conditions relate to each other. It will provide further insight into the complex relationship between diabetes and mental health. If this research is successful, we may be able to identify ways to improve the care of individuals with diabetes. Description: Diabetes is a disease with a significant psychological impact on patients. Diabetes can impact people in many ways, including their overall health, prognosis, and morbidity. It also affects their relationships, which are essential for emotional well-being. Although the psychological impact of diabetes on relationships is complex, it is important to understand the emotional and psychological effects of diabetes and how to manage them effectively. Using a narrative synthesis method, we identified articles that discuss the psychological impact of diabetes and its effects on individuals. The most common themes reported by participants included the high cost of health care, difficulty feeling the pedals of a car, and concern for complications of diabetes. In addition, women reported that they had multiple emotions simultaneously, and sometimes felt angry and sad. This was a significant cause of poor self-esteem, as the woman who was driving felt that she had no choice. In addition, women reported experiencing dizziness and low blood sugar that affected their ability to drive. Emotional and cognitive decline is also associated with diabetes. This interaction between diabetes and a person's emotional well-being should be evaluated routinely in young people with type 1 diabetes. The American Diabetes Association, ADA, and the International Society for the Study of Adolescents and Children with Diabetes, ISPID, recommend screening for emotional well-being as an early intervention in people with type 1 diabetes. But implementing such a strategy is not easy. The neuropsychological impact of diabetes is profound. Young people with diabetes experience difficulties with their psychosocial development. Their performance in school is negatively affected and their ability to function in other areas. Eventually, type 1 diabetes can affect their relationships and careers. The psychological impact of diabetes is so profound that a substantial minority of adults with diabetes experience difficulties managing their condition, including in relationships and parenting. A study conducted by Hager et al. Found that diabetes-specific distress is associated with a substantial amount of depression and anxiety, as well as an increase in the risk of suicide. In addition to the physical consequences, diabetes can also affect the person's cognitive functioning, including attention, memory, and executive function. This significantly reduces the quality of life for those who live with diabetes. Depressive episodes in people with type 1 diabetes are more likely to be severe than in the general population, and patients often experience a fourfold increase in symptoms. While these results are encouraging, they are still not enough to dismiss the potential consequences of the disease. The psychological impact of diabetes is difficult to appreciate for people without the disease. They stand in the middle of a complex web of social and biological forces. For people with type 1 diabetes, it is imperative that they receive the appropriate support and guidance to cope with the psychological effects of the disease. Diagnosis. When a person is diagnosed with diabetes, the initial shock may be overwhelming. Diabetes requires constant monitoring of blood glucose levels and insulin administration. This may feel like an impossible challenge. For some people, the mental and emotional impact of diabetes can even be severe. They may feel guilty or hopeless about their condition and may feel as though it will never go away. But the truth is that diabetes is a complex condition that affects both the mind and body. People with diabetes must also consider their food intake and use. A high HbA1c level is a predictor of eating disorders, but the psychological impact of diabetes is often overlooked. Those with type 1 diabetes are twice as likely as their peers to develop psychiatric disorders. Their incident rates are 15%. This is similar to the rate for young adults with diabetes diagnosed during childhood. Diabetes-related eating disorders and mood and anxiety disorders are among the most common psychiatric conditions among those with diabetes. Many people with diabetes don't attend education programs designed specifically for this purpose. Many reasons for not attending such programs are multifaceted. They may not understand the importance of attending these programs, lack time, have competing priorities, or simply feel uncomfortable in a group. In such cases, working with a psychologist may be the best option. With the help of a psychologist, patients can access the support they need to cope with their diabetes. While research is scarce on the cognitive effects of diabetes, studies have shown that children with type 1 diabetes have decreased attention, memory, and executive functions. Cognitive decrements in children with diabetes can begin as early as 2 years after diagnosis. In fact, some of these effects are more pronounced in young children. This may be because type 1 diabetes is a chronic condition that affects the brain. Therefore, it is important to find out the exact nature of the cognitive effects of diabetes early on. There are several studies that indicate that patients with diabetes can experience anxiety and depression. The authors of one such study looked at 339 adults with type 1 diabetes and found that depression and anxiety were the most common symptoms among women. Women 64 years of age and older were the most likely to experience depression and anxiety. The researchers also noted a difference between age groups. Midlifers were more likely to be anxious than younger adults. Treatment. Diabetic patients can face many psychological challenges, and many of these difficulties may lead to decreased self-care behaviors and decreased call. Psychosocial issues can lead to poorer glycemic control, reduced call, and increased mortality and healthcare costs. A good psychological intervention can reduce emotional distress and improve diabetes adherence and self-care. However, research on psychological interventions for diabetes patients is limited. This article provides an overview of the psychological impact of diabetes treatment. Diabetic patients are often affected by their families. Some loved ones become overly involved with their diabetes management, while others withdraw completely. A psychologist can help people deal with these challenges by facilitating a dialogue between the patient and his or her medical team. The psychologist can also provide a safe space for patients to voice their feelings and encourage self-care. For patients who are unable to attend regular educational sessions, a psychologist can facilitate a supportive environment and enable dialogue with the healthcare team. Diabetes-related distress is a leading cause of depression and other health problems, and 1/3 of adults with type 1 diabetes suffer from high levels of depression. These patients also report significant difficulty managing their diabetes. This can lead to diabetes burnout and further deterioration in glycemic control. Hypoglycemic events can negatively impact work performance, relationships, and emotional health. In addition, 20% of diabetics report impaired awareness of hypoglycemia, which increases the risk of a serious hypoglycemic episode. In addition to anxiety, hypoglycemic events can cause patients to suffer from the fear of hypoglycemia. This fear can severely impact normal functioning. Increasing self-management skills among people with diabetes can be a benefit. Self-management skills are critical in the treatment process. A collaborative care intervention, involving a psychiatrist, a primary care physician, and a nurse care manager, can improve patient health and self-esteem. The therapist can also help patients understand and overcome the psychological factors causing their self-care challenges. In addition, the psychological impact of diabetes treatment is often overlooked by diabetes patients. Thank you for watching. Please like, comment, and subscribe if this was helpful. Stay healthy and let's beat diabetes.